Oh, there it is. Come on a minute.
We're about to start.
All righty, thank you. Thanks for everybody being here. Let's go ahead and bring the Subcommittee on Health for Appropriations. And we're going to open it up with Senator Dugan. You're on number 4, probably.
Yes, yeah. If y'all would reflect with me here. Lord, we come together with people thinking we're going to be talking about money, but we're not. We're talking about using a precious resource that we've been given to help improve the lives of all Georgians. Help us work past the political divide on this and come to a decision where we can come together and allocate these resources in a way that helps the greatest number of Georgians in the most positive way. In your holy name we pray. Amen.
Thank you. Thank you so much. We're going to we're going to change the order here a little bit. We're going to let the Department of Veteran Services go first since they have a bill to present, and the floor is yours. The committee is working on page 56. Give me just a second. The podium, there we go.
Okay, thank you, Chairman Watson, members of the committee. I'm Trish Ross. I'm the Commissioner of Georgia Department of Veterans Service, and I'll go through my initial slides very quickly, and we'll get to the budget slides. But just as a reminder for those that have not been on this subcommittee before, our mission within Georgia Department of Veterans Service is to serve the almost 700,000 veterans and their family members eligible for benefits under the Department of Veterans Affairs. We have 2 skilled nursing homes that provide care to our older war veteran population, and then we have 2 cemeteries that provide memorial services to eligible veterans and their family members. Our population here in the state of Georgia, again, is right at about 700,000 veterans. We've declined slightly over the last year, 7,000 to be exact, but you can see the percentage of our women veterans is increasing, and they are the largest growing population of women veterans. They're here in the state of Georgia, and that's compared nationally. When you look at, even though our number of veterans are decreasing, those veterans have increasing needs, and so you can see our compensation and pension, or the benefits they're receiving from the Department of Veterans Affairs, has increased to the tune of almost $3.6 billion, which is attributed to members of Georgia Department of Veterans Services, and they're applying for benefits for those veterans and their family members. Looking at, if I compare last year to this year, we had 70,000 more calls than we did the previous year in 2021. We had 20,000 more office visits, and you can see even with our hearings and our appeals, we're serving well over 4,000 through the appeals process. We had about 500 additional internments over the last year, and so overall our numbers are increasing year over year, again because the population of veterans, their needs are also increasing. This is just our public service announcement. The PACT Act, which is probably the largest legislation the VA has put into law as far as presumptive conditions based on when you served. We have both Vietnam, which expanded it to 5 different countries, as well as our post 9/11 veterans, not only expanded it to multiple countries within the Southeast Asia, but a variety of illnesses that one could come down with based on exposures to toxins due to burn pits. The impacts on Georgia, specifically of our 700,000 veterans, about 500,000 could be impacted based on their service and where they served. I did want to thank you. General Assembly approved a suicide prevention and outreach coordinator, and she has been very busy since we hired her last July. This is just some of what she has been doing, mainly training our staff and getting out and doing outreach events. So thank you so much for that. We've also been working with DBHDD to close those connections to make sure that our veterans who are at risk get to the services they need immediately. So looking at the budget, I realize this is very, very small. We only really have a couple of changes that are both in the governor's budget and then in the House recommended budget. You can see under departmental administration just over $160,000. That is to digitize our DD-214s. And so that is line number 359.1 on your tracker. And what that does is we have tens of thousands of hard copy separation documents held in filing cabinets where when a veteran service officer calls and tries to find one of those documents, we go through that cabinet and try to find them. We don't have a comprehensive list back to the 1970s, just those that were sent to us because an individual had decided that Georgia was going to be their home of record. We would like to be able to access those almost instantaneously and have those in a searchable database, so we don't have to have our staff having to run to those files to try and get those documents, which are so important for not only your VA benefits, but we get a lot of calls for burial benefits, so somebody can be buried with honor. So that is a one-time cost for that. And then the other change you will see is $1 million under our veteran cemeteries, which is 360.1. That is a decrease of $1 million. That has been a placeholder for the last 4 years for the Augusta Cemetery. The community in Augusta has come out in force to try and get a cemetery through the VA in the grant program that we work together. That is the state matching funds. We did not meet the VA's criteria. We were just shy of their cut line. And so we're hoping that while this is removed from this year's amended FY23 budget, that it would be put in the 24 budget so we could reapply for that grant. Those are the only two changes in those two programs for the amended FY23 budget for veteran service. Pending your questions.
Thank you so much. Any questions from the committee? If not, we have one question. With the digitalization of those DD forms 214s, is there a reduction or change in the space that's going to be needed for all those paper forms that were done before, or how's that going to work?
Yeah, we would be able to reuse that space. Right now we have two kind of long areas of filing cabinets that would enable us to actually do a better job of storing our IT equipment before we distribute it to our field offices.
Okay. Thank you so much. Any other questions? Well, thank you so much. We appreciate you bringing that to our attention, and appreciate presenting your budget. Thank you so much. So we're going back to the order that we had arrived at. So the Department of Behavior, Health, and Developmental Disabilities, Commissioner Tanner. And I think we do have a handout from you. Is that right, I think? Yes. Does everybody in the committee have that handout?
Are you missing the slides for the commission?
No, he's got that.
Thank you very much.
Commissioner Tanner, the floor is yours.
All right. Thank you, Mr. Chairman and committee. Good afternoon, Chairman Watts and members of the committee. Thank you for the opportunity to come back before you today to present the amended FY23 budget as passed by the Georgia House of Representatives. I know you all have a packed agenda today, and out of respect for your time, I'm going to go ahead and jump right in. One thing I've learned as a former legislator in the House is that the Senate likes brevity, so we're going to try to stick with that. So I certainly want to respect that, and we'll get started. All right. DBHTD's budget begins in Section 15 of your budget document. I first want to begin with the adult developmental disabilities, which I will refer to as adult DD. The first four items you see here from tracking numbers 60.1 through 61.2 represent
I'm going to interrupt you just for a second. So for the committee, we're all on page 3, and we've got the 60.1. Everybody's probably there except me, maybe, but sorry for the interruption.
No,
go ahead.
Thank you, Mr. Chairman. 60.1 through 61.2 represents the transfer of funds from an adult DD special project back into the adult DD general budget. This is transfers budget neutral and has no real impact on services. Next, moving on to adult forensic services, line item 62.1. This represents a reduction in funds due to the delayed start dates of forensic peer mentors that were appropriated in the FY23 budget. Line 63.1, this is under adult mental health services, increases the rates for private psychiatric beds statewide. This is the first increase in this area since 2014. The dollar amount you see here increases the daily rate from $675 to $840. Over the years, we've become, as an agency, more reliant on private psychiatric hospitals who often serve as the safety net of our safety net. In the last month, about 15% of DBHDD's crisis beds where adults were offline due to severe staffing shortages. This number tends to be even higher when it comes to children's crisis beds, which often require more specialized care. As a result of these changes, the state purchases beds from private facilities so we can continue to serve those in most need, even when our capacity is limited. On any day last fiscal year, there were about 120 people in one of these private beds due to staff shortages at crisis centers. As you continue to invest in the state's expansion of behavioral health crisis centers, it's my goal to reduce our reliance on these contracts by 20% annually beginning next year for the next 5 years, so we can reinvest these dollars into Georgia's own crisis bed network and do away with the reliance on private systems. This mission will also be reliant on key investments in our workforce, so I look forward to continuing to have those conversations as we begin talking with you and you begin considering the FY24 budget. I'll now move on to the next item in the line, which is adult mental health services, line 63.2. The House added $825,000 for Partners for Home, which is one of our many providers who work with the homeless population. This funding is intended to enhance outreach services here in the Atlanta area, and I know it was a priority in the House. Next, continue to the next slide with child and adolescent mental health services. I'll draw your attention to line item 67.1, which recognizes $100,000 in savings due to the delayed implementation of contract stemming from FY23 budget. Under the same program area, the House also added $600,000 for psychiatric residential treatment facilities, also known as PRTFs. This line item is a result of ongoing negotiations between the PRTF providers, the General Assembly, and the Department of Community Health regarding those rates. The next two line items fall under the departmental administration, and are related to the administration of the opioid settlement dollars. 68.1 reduces the original appropriated amount in House Bill 1321, which was never enacted into law, so obviously those funds were not needed. 68.2, the House added $300,000 for administrative needs for the department to support the statewide distribution of opioid settlement dollars. As you know, over the next 18 years, the state will get over $600 million in opioid dollars coming to the state. I'll now move on to direct care and support services, which I want to spend some time on since it represents the infrastructure of our 5 state hospitals and thousands of staff who are critical to the operation of the hospitals. Last year's budget language directed DBHDD to bring 45 beds at Georgia Regional Hospital in Atlanta and 47 beds in other state facilities online by November 15, 2022. Since March of last year, I'm glad to share that we have brought over 90 beds online across the hospital system. This number fluctuates based on a variety of factors, but for the most part, there's been some steady progress being made in opening beds since July. However, to be completely transparent, this increased capacity relies on the support of Jackson Healthcare, a third-party provider. For example, since June of last year, we saw a net gain of 208 non-clinical hospital employees as a result of your investment, compared to just 37 nurses. And because nurses are critical to the oversight of the care environment in our hospitals, this is an area we're still heavily relying on Jackson Healthcare. As of this last month, we were spending $1.6 million per week on Jackson Healthcare, $1.1 million of that going toward keeping our unit staff with nurses. So as you can see, 69.1, the governor's office originally recognized savings of $1.9 million due to delayed hiring of staff related to opening of beds. The House has taken the step to restore those funds, which will allow us to fund Jackson Healthcare for a few more weeks as we continue to work diligently to try to bring back our critical staff. I know many of you share the same passion and commitment to the state workforce as I do, so I look forward to continuing the conversation in the week ahead, working with both the Senate and the House to find solutions to our workforce crisis here in the state. Because the hard truth is that our state hospital workforce, as well as the provider networks for both behavioral health and developmental disabilities, are in a state of emergency. Also, we need to tackle this from all fronts, because there should be no wait list for someone in crisis or an offline bed for someone waiting in a jail cell or emergency room. So I thank you for the investments you have made thus far, and I know that you have I want you to know you have my full commitment in working with you all to ensure the vacant positions of today become the filled positions of tomorrow. The last 2 items in the direct care budget are related to capital improvement projects across our hospital system. The 5 campuses we operate compile 239 buildings spanning over 856 acres. We have a list of ongoing infrastructure needs that are critical in providing a safe and healthy care environment for our state employees and patients. Both of these projects you see are a priority of the department, so I ask for consideration in supporting these investments. You may be asking yourself, I know what a kitchen renovation is, but what is a treatment mall? So as I conclude, I want to take a brief moment to explain to you what this is and why it is a very important investment to us at the hospitals. The treatment mall is a centralized location on hospital grounds which individuals can attend psychoeducational therapy and skill-building groups and interventions. Think of this like a student center at the university campus. The building itself is designed to deviate from the institutionalized filling of state hospitals and provides new opportunities for staff to implement evidence-based interventions and approaches that may be difficult to practice in crammed residential units. Our patients tend to appreciate the change of scenery and a chance to socialize with fellow patients, while also learning new skills needed to demonstrate readiness for discharge, which is ultimately the goal. I will tell you, I was at Central State yesterday visiting with staff touring the hospital and had an opportunity to visit our maximum security wing at that hospital. It was absolutely incredible what the staff was doing with those individuals and how they were bringing them to competency. I was extremely impressed with their work and the dedication of that staff there. The mall provides group activities that are not typically available on the residential unit, like art, music therapy, exercise and recreation, vocational training through the work program, access to a library, or computer training and educational services, just to name a few. These are all essential skills needed not to only heal on the path to recovery, but also to provide a sense of empowerment to the individual for when they transition back in the community, which almost all of these individuals will ultimately do. In the absence of a treatment mall, the individuals we serve have limited access to therapeutic opportunities and interventions, will be forced to stay on residential units where their interactions with others is limited to only those that reside there and the staff that work on that particular unit. Treatment malls also help decrease the frequency of aggressive behaviors that can boil up when stuck in a residential unit day in and day out. The total cost of a treatment mall is $8 million, so the House addition covers half of what is needed. If fully funded, this appropriation would fill a long-standing mission of the department to place a treatment mall in every one of our hospitals, with this one at East Central Regional in Augusta being the last one needed to fulfill that obligation. Mr. Chairman, with that, this concludes my presentation. I thank you for the opportunity to present our FY23 budget changes, and I'll be more than happy to answer any questions.
Thank you, Chairman Tanner. I do have a couple of questions. Maybe just follow up on the treatment mall, the $4 million the House put in. So do we have a timeline and sort of scope on that particular renovation?
Yes, if it's fully funded, we'll encumber those funds by before July 1st and begin immediately. We've done these at the other hospitals, so we have a general design and are ready to go to work.
Okay, good. And just circling back on the Jackson Healthcare staffing issue, that's, I think it's over $1 million per month, if I remember correctly. So the census of the offline beds at the state hospitals, do we know what the current census is from that standpoint?
Yes, and just to make it clear, it's 1.6 million per week.
Per week?
Per week on Jackson Healthcare.
Just 4 times off there.
That's right, and so that 1.9 million that was restored will fund that for 1.5 weeks. So it's a fairly fast burn rate that we're having. So it's significant.
So how long is there a timeline on being reliant on that?
Well, yesterday would be my preference that we no longer had Jackson, but the challenge, quite honestly, is the challenge of the workforce. We're doing everything in our power to recruit. I will tell you that just the facts are, if you look at what we pay our clinicians, and you obviously are very informed about the healthcare side of things, but we're well below DOAS standard of what those individuals should be making. So it's challenging for us to recruit, and it's a difficult environment for people to obviously work in. You're dealing with some challenging opportunities there, but we've got a wonderful staff. But the other thing I'll also tell you that we found in the hospital setting, our staff does a much better job because they're committed to the mission at DBHDD and what they're doing versus the folks we get from the third party. But to answer your questions, as of February 1st, we have 41 of our hospital beds offline because of staffing.
And is this going to go to the FY 2024? Do we have, how far do you think that's going to go through?
Well, we're using all the savings we can find within the department now to self-fund this burn rate. We don't have any funding for this, so we're having to, for lack of a better word, rob from Peter to pay Paul to try to make it work. Our goal is to decrease Jackson as quickly as possible. And that number was higher. We've added the employees and be able to bring that down. But if we completely cut out Jackson, we would put the system into crisis. So
I understand. You certainly got to take care of the patients. It's a tough balance. We have a question, number 8, looks like is Chairman Strickland.
Thank you, Mr. Chairman. The $1.6 million you mentioned, how many nurses do we get from that or other staff members?
I can get you a report on that. I think we operate around 500 or so Jackson Healthcare employees in the system currently, but I can have our staff will send that out to the committee, the exact numbers, but I believe it's right around 500 Jackson Healthcare employees that are inside our facilities.
Thank you, Mr. Chairman. And Chairman Kirkpatrick.
Yeah. Thank you, Mr. Chairman. I had a couple questions. The first one, I want to commend you on going ahead and preparing for the opioid settlement dollars that are going to be flowing into the state. But my question is that money going to come back to the state, that $300,000, once that money starts to be allocated?
It's obviously, as you know, the final agreements, and I think the trust agreement may have been filed by the Attorney General's office now with the court, so those details are still being worked out exactly how that's going to be done. But it's my understanding that some of those dollars can be used to cover the overhead of operating the program. Yes, ma'am.
Okay, thank you. And then one other thing on the daily rate for the hospital beds, you lost me a little bit. There's two different line items. One is private contract beds, line 63.1, and then there's also 67.2, the one-time gap funding. Can you just talk about the difference?
Yeah, the item relating to the $2 million in some, I don't have the number right in front of me, but that is for the private beds that we use as our safety net of the safety net, so to speak. Those are adult behavioral health beds where we have to place someone because we just don't have a crisis bed. Typically, it's a crisis bed, not a hospital long-term bed, crisis bed available. And again, that's because a lot of our CSBs and providers are just offline because they're having the same problem we have, which is staffing shortages. So those are private facilities. They've not had a rate increase since 2014, so they pretty much, as you know, have put the state on notice. We're no longer going to take these patients at the end of February unless you give us an increase because we're losing money.
I support it. I just didn't understand the difference. Thank you.
Yeah, and then the other piece was the $1.9 million, which I was referencing, dealing with our staff in the hospital.
Senator Ulrich, is that you had a question?
Thank you, Mr. Chair. Thank you so much, Commissioner,
Thank you.
for your diligence and leadership, and you're just a real addition to moving forward on these challenges. Thank you for your leadership.
Thank you very much.
In terms of what I've heard from the this whole issue of the substance abuse disorder and the success of peer programs, is that addressed at all in terms of like the warm line, the CARES line? Is there any money that's been changed in this continuing budget to bolster any of that work that is apparently yielding real results? Peer investment in peer training.
Yeah, and you are absolutely correct. Georgia is known nationally for their peer support work. It's one of the best in the country, and others call on our peer support groups to come and lecture and talk about that across the country. There's not any changes in the budget specifically to that. Our hope also, though, is with the opioid settlement dollars, it would be our hope that we'll see an investment made with those dollars into that, because I've said, our department has said, we need to make sure that people who have lived experience have a seat at the table in helping make some of those decisions, because obviously they know best oftentimes. And so we're excited to work with our peer groups and moving that forward. But nothing has changed in the budget reflective of that. No, ma'am.
I would just support any progress we can make on that, because it's now becoming kind of a standard requirement of institutions looking for those peers that are certified, states, that have been through our certification program. I think there are about 1,000 to date.
Yeah, they do an outstanding job, and we use, peers are being used with substance abuse, but it's also behavioral health. Even meeting with folks who are working on the homeless issue here in Atlanta and being able to go and encourage someone to come in and get the resources they need. They're even utilizing people who once were homeless who are peers. So it is something, if I haven't walked that journey like that peer has, so that it's much easier for someone to listen to the peer than it would be someone like me. So it's very successful.
Thank you very much.
Senator Tillery.
Thank you, Mr. Chairman. Thank you, Commissioner. I got two questions. One is back to I think some other folks had questions about Jackson Healthcare's contract, which made me just come up with one or two of them. How many, do we have any statistics that show how many of those employees working for Jackson Healthcare used to work for us? Or do you know any anecdotal evidence of that?
I do not. I don't have any knowledge that any of our folks left and went to work for Jackson, but I also cannot, as I stand here, verify that. I can talk with Dr. Rigsby in our hospital section and ask him if he knows if we have any of those folks, but to my knowledge, that has not been a big issue.
And then one more question, if you don't mind, Mr. Chairman. On the 60.1, 61.1, the exchanges, I understand the special project that the Senate did last year for respite care. Was that a department request to move that back into the general budget?
That you're talking about where the House made a change to the OPB's budget? No, we didn't request it. I will say we have no issue with it going back. It probably actually works better the way it's came over from the House, but either way, it's not going to have a material change.
Thank you.
Senator Dugan.
Thank you. That actually was kind of my question as well. What can you do with that $500,000 in 60.2 that you couldn't do with it in 61.2?
It still is going to be tracked either way, but what we could do is put additional dollars with it. So in other words, if that money wasn't enough, but we had other dollars available in our program, we could supplement that, versus if it was in another line item, it would be more challenging.
And could you take money out of it?
No, you could require, and we would normally do it anyway, we track the program so we can provide you the dollars that were spent on that, but so you could restrict that from happening. Yes, sir.
Okay. Obviously, I just perked up when I saw it.
Yeah.
It's a passion area of mine. One of the good things that we have about healthcare today is so many of those living with developmental disabilities are living much longer and better quality lives. But the parents are also getting significantly older and need the respite care for a little bit to have them have a chance to catch your breath.
That's right.
If we do away with that, then it's going to have a significant negative impact on a wide array of Georgians.
Yes, sir. No, sir. The department definitely has no desire to do away with it. It's a huge benefit to individuals doing self-care of their loved ones.
Okay. Thank you.
Yes, sir.
Thank you, Senator Dugan. Any further questions from the committee? I don't see any. Chairman Tanner, thank you for presenting. I appreciate the work that you're doing. I know you've been on the job now for...
It's getting close to 2 months. The 16th will be 2 months, next week.
All right. You're doing a great job. Thank you.
Thank you. Y'all have a good day. Thank you.
All righty. Next up is Georgia Board of Healthcare Workforce, Executive Director Chet Basine. As he's making his way up, the committee is page 22 of our document.
Good afternoon, Chairman. Good afternoon, committee. I want to say thank you in advance for allowing me to present. Glad to be here to share the updates about the board and the amended FY23 budget. Just as a brief introduction to the board, or reintroduction for those that are new, we are the Healthcare Workforce Board, more commonly known as the folks that administer loan repayment programs for physicians, dentists, nurse practitioners, and physician assistants, graduate medical education and undergraduate medical education funding, and more. So that's kind of at the high level what we do, and I'm glad to field any questions now or along the way.
Just a comment. I mean, I think the auditors for the state have shown that this is one of the most successful programs in the state, and I think I don't know who to pat on the back, whether to pat the workforce or the legislators that did that or the expansion, but statistically, getting healthcare workers to stay in the places that they are has been audited and has been a rather phenomenal success. I apologize for interrupting you.
No, thank you, and I appreciate it. There are two, what I'll start with is the two items that came out of the House for the amended budget for Healthcare Workforce Board. The first one is line 98.1. There is $237,966 allocated towards St. Francis Hospital. They have started up an internal medicine residency program, and those monies are there to fund their capitation payments. And then the second and final item is for it's a line item 102.1. It is $56,000 for a nursing program, nursing school in the southwestern portion of the state. I believe it's Andrew College. So those are the two AFY items. Are there any questions or anything I can answer on that?
Any questions from the committee? If not,
okay. Then I was asked to provide some additional information on the $3 million it's in our current budget for FY23 for nursing schools. This is the competitive grant process, and I'm pleased to say that we received a little over 30 applications. The rules of the process allowed some schools, or actually any school, to apply more than once if it was for different programs. Some schools did take us up on that, so it's a little less than 30 schools, but little over 30 applications. About $15 million came in of requested funds for the $3 million that's been allocated. There is 5 of us. I'm one, and there are 4 board members from the Workforce Board. We are all readers of these applications, and we anticipate having call it the final scores here, hopefully by the end of this month or early March is what we're really aiming for. In the meantime, we are working on a shell for the contract, so as soon as we've got those who are awarded the funds, we can move swiftly so that they can deploy the funds that they have earned. Any questions regarding the nursing grant application? Okay. And then the second item I was asked to provide some additional detail on is the graduate medical education, or GME funds. At a high level, I'm going to use the fiscal year 22 numbers since it gives us a full running 12 months. The Healthcare Workforce Board provided residency capitation dollars for 24 institutions. It totaled just under $27 million at $26,829,079, and that funded 1,848 different GME slots around the state. That is the conclusion of my presentation and my updates. I'd be glad to entertain any questions.
any questions from the committee? Great, appreciate the budget and the overview, and thank you for the work you're doing.
Thank you, Chairman. Thank you, the committee. Have a great afternoon.
Yeah. Department of Public Health, Commissioner Dr. Toomey. And for the committee, so we're on page 48. Floor is yours when you're ready.
Thank you, Mr. Chairman. It's good to see you.
Presentation.
And good to be here. Here, I'll let you. Sorry. wanted to very quickly go through some of these early slides. You've seen them multiple times, that I think it sets the context in which we're giving the budget. Again, the structure of public health, unique. Oh, sorry, okay.
You're good.
Thank you, Mr. Chairman. The unique structure of public health, which is unusual not only as a Georgia state agency, but really for any public health agencies that I'm aware of, with a hybrid model with health districts that report to the commissioner, but 159 independent county health departments that report to the district health directors. Again, very quickly wanted to run through these budget pie charts because, again, it sets the context for the entire budget. These are non-COVID funds, so these are federal and state funds, but our total budget without the additional COVID dollars, you can see that the vast majority of all of our funding goes to direct services. Only 17% of our budget goes to state staff. All the rest is to direct services. And even the contractual services are services, for example, at Grady or through the Ryan White program and other contracts that serve individuals. And so I think the take-home message here is that, you know, we are a service agency, but it's not our staff that are doing it, but the money is being distributed with statewide through county health departments and through other organizations. So this includes everything from WIC as well as the grant and aid, both programmatic and state grant and aid. Next slide. And finally, just a reminder, again, this is non-COVID funds. These are, but that 50% of our budget is federally funded. And so we really are dependent on those federal funds, both for things like WIC, but also for the CDC grants that are programmatic for HIV, for prevention, for HRSA, for HIV treatment, and the other programmatic funds for disease prevention. Our state general funds, about 45% of our budget, half of those funds are distributed to the county health departments. So a significant proportion of our budget, again, state budget, goes out to the counties. So why don't we move on to the budget recommendations from the House. And I think I'll be very quick because I think this will be a brief summary. The Emergency Preparedness Trauma System Improvement is actually a redirection or an allowance enabling of GCC to utilize the existing funds that they've received as a pass-through through us to them to purchase some special software that will allow triage, more effective triage, both to ambulance services and hospitals. And so it's a communication system, and this is just enabling that to occur with existing funds. So there's no actual budget number noted. The reduction in funds for inspections and environmental hazard control, $407,955, has to do with the lead inspectors. You know, we were able to get some additional funding last year to be able to hire lead inspectors for all of our 18 public health districts. We've been really very aggressively reaching out to try to be able to bring new staff on board. It's a difficult time to be hiring staff, even with these budget increases. And so this is a reduction to account for the 5 vacancies. We fully expect that to be restored in the full budget, but this will allow those funds for this year to be used. We are, by the way, aggressively working with the University System of Georgia and others to be able to help with recruitment of these critical, mission-critical, important positions for child health. And the final change is a $1.7 million reduction in grant and aid to counties. I don't know if you remember that last year there was a line item that was specifically targeted to Dawson County for a new health department and also for some mitigation in a building in Clay County. That was line itemed out by the governor, and we were not going to use it for those specific projects, and we anticipated that this would be removed from the grant and aid. This will have really no impact on the service delivery in our counties through grant and aid. And that completes my presentation, and thank you very much, unless you have questions.
Thank you, Dr. Toomey. Any questions from the committee? Well, different than in the past, but we have a late arriving question there, Senator O'Rourke.
Thank you, Dr. Watson. Thank you. Commissioner, good afternoon. Thank you for your lifetime of leadership on these issues. And this isn't any pertaining to the remarks that you made today, but it was announced on the radio this morning that Georgia's way behind a lot of states on putting in investing in the PrEP, availability of PrEP for HIV. And could you address that? I'm just taking advantage of the fact that you're here and that's within your realm, and it got broadly lifted up this morning on the local radio station about that we're not keeping up with other states on our financial investment in making the PrEP available.
And we are very committed to expanding the PrEP program, and you will see in the full budget there is an expansion of PrEP, and we will be addressing those areas that have not yet begun PrEP programs. Metro Atlanta has significant investment in PrEP and almost has developed what we consider to be model programs, as have other areas like Dalton has an extremely good PrEP program that they've been able to work in that particular area, but many rural areas do not have that. And so we're looking to the new funding to be able to use some of these model rural and urban programs to be able to expand, because we recognize that coupled with the expansion of our treatment programs are how we will end HIV in Georgia.
Well, thank you for that. And again, successful pilots, areas where we're succeeding and achieving and overachieving, getting results that we look for when we invest. Let us all resolve to turn those pilots into statewide by the funding, and that's what lies ahead of us, I think, the challenge.
Thank you. We hope that those aren't pilots. Those are going to be continuing programs.
Yeah, those are continuing programs going on for quite some time, and so as the radio said this morning, we'll be staying tuned for 2024 budget, right?
Absolutely.
There we go. All right.
Yeah,
All righty. Thank you. Any other questions? See no further questions. Dr. Toomey, you've done a fabulous job through COVID, and I know it's been very challenging. I hope you've taken a good vacation somewhere along the line, and thank you again.
I'm enjoying what I'm doing now.
Okay, good deal.
No, thank you so much.
All righty. So our biggest department here, Department of Community Health, is already approaching. Commissioner Noggle, thank you. And for the committee, we are page 12, if I got that correctly. All right, the floor is yours. Thank you.
Good afternoon. Thank you, Mr. Chairman. Again, Kaylee Noggle, Commissioner of the Department of Community Health. I'm just really going to be pretty brief with you this afternoon and cover changes to the governor's budget recommendation made by the House, and obviously happy to talk about any of our other priorities or any other questions that you might have. But just as a starting place, as a reminder, our base budget for FY23 is $4.4 billion in state dollars, $18.2 billion when you include our federal funds. If we start at 87.1 on your tracking sheet, which is our department admin program, there are no changes from the governor's budget in the House version. At 90.1 in our healthcare access and improvement, there are several changes, several additions. The first is $25,000, an increase in funds for a rural hospital study. Those are pass-through funds for Southwest Regional Medical Center to do a study related to their current service delivery model and some changes they'd like to make. I believe that the total that the hospital asked for was $50,000, so I believe the House funded half of that. At 90.2, increased funds to support existing housing within the AHECs, or Area Health Education Centers, for $184,000. That is to support their existing inventory of housing and beds for students in those programs. That's 321 beds that currently exist that those funds will support, just, I believe, due to rising costs. 90.3 is an additional $778,000, again, pass-through funds to support the Psychiatric and Internal Medicine Resident Learning and Work Center at St. Francis Hospital. This is to expand their program from 3 residents to 7, and then an additional $398,000 to support one-time construction costs to accommodate the growth of that residency program. In healthcare facility regulation, this is $250,000, add funds to implement and regulate the new licensure category for adult residential mental health programs. If you'll recall, HB 1069 passed last year, which creates a new licensure type for essentially not quite acute inpatient care, but subacute for adult mental health programs. These are voluntary placements inpatient, and this allows us to, this bill was subject to appropriation, so this appropriation will help us to implement that. We are actively working with at least one provider who's seeking a provisional license that was allowed in that bill, and we anticipate presenting rules on that licensure type to our board this spring, with it being available starting this summer. The Indigent Care Trust Fund, no changes. Medicaid, age blind and disabled, or our ABD program, there is one yes item, and you heard Commissioner Tanner mention this one earlier. At 93.11, recognize one-time gap funding provided to the Department of Behavioral Health and Developmental Disabilities for psychiatric residential treatment facilities receiving less than $500 per patient day while under the current cost report model. So certain fee-for-service costs related to behavioral health are funded within the Department of Behavioral Health and Developmental Disabilities. We manage that policy and the payments and the contracts to those providers. So this is instructing us to recognize those funds. It essentially sets a minimum payment rate of $500 for all those facilities, and there are 6 of those in the state. Low-income Medicaid, no changes. Peach Care for Kids, no changes. There is a significant change in the state health benefit plan. 96.1 is really just a true-up. I think there were some additional state health benefit plan funds added to other entities throughout the budget that were originally omitted. At 96.2, though, there's an infusion of $100 million. I think what you'll see here is the phase-in of what would be an increase in the per member per month for non-certified school employees. So if you'll recall, in the FY24 budget, there is a per member per month rate increase from $945 to $1,580 for both certified school personnel and non-certified school personnel. The state covers the cost of the certified school personnel in the QBE formula funds within DOE's budget, but not for the non-certified. So as opposed to, I think the House approach here, as opposed to making the jump from $945 per member per month all in one year, this funding will let us put some of the money in reserve in the plan to stabilize it and phase in that per member per month increase incrementally over 3 years. So in FY24, instead of going to $1,580 per month for the non-certified, we'd go to $1,157, and then incrementally on up from there for the next 2 years until we get to the full $1,580. That's a lot. That's a little complicated, so happy to walk through that again or answer questions. But that is the last change in our budget. So in total, the House had the difference between the House and the governor's budget was an addition of $101 million, mostly in that SHPP item. Happy to answer any questions, sir.
There we go. Any questions from the committee? Let me just a couple follow-ups here. The nurse surveyor positions, That's with matching federal funds, or is it eligible for matching federal funds? I guess that
There's
is
a cost allocation associated with those.
okay. All right. The Rural Hospital Stabilization Grants, and how many have been awarded thus far this fiscal year? Do we know that?
No, so they're usually awarded late in the spring, so it's a competitive grant process. So those applications will come out here pretty shortly, and then they'll be awarded and encumbered before the end of the fiscal year.
Okay. The one-time gap funding for the PRTFs, they're included in the federal match, or are they is that?
It is not drafted that way in the budget, so we're not sure that we'll get CMS approval for this. But we will try if so instructed. So we've seen some other states do it, but I think we always have the flexibility to do some things for our providers that are fully state funded, and I think the funds recognized by the House would ensure that we can do that regardless, if that's the will. But we're not sure. We still have a pending rate increase with CMS that has not yet been approved from last year, so this is a little bit of a safety net in case that doesn't come through.
Okay, thank you. Chairman Hickman, and the phase-in, the 3-year phase-in per member per month, is the thought process there. Just can you help me understand that?
I can try. So I think when this recommendation originally came out, obviously because the non-certified school employee rate is covered by the school systems, that's a lot for them to take all in 1 year. I think the budget originally recognized $420 million or so in increased revenue, which is paid by the school systems, which really, because of the start date in January 1 of 24, only accounted for half a year. So for a full year, that's a significant budget item for the school systems to come up with all at once. So chunking this up into smaller incremental annual pieces over 3 years, I think should help them budget for that a little bit better. And so this is the House's approach to do that. We've taken the overall where we want to get to, which is $1,580 a month from where we're starting at $945, and taken that difference and divided it into 3 to do a step increase each year.
Okay. Looks like the committee is silent, so you've answered every question there is. There are no thoughts at all, so certainly appreciate that. Commissioner Noggle.
Thank you.
Thank you so much. Next up, Department of Human Services. Commissioner Brose is here and on her way. So when she's getting set up, the Department of Human Services, committee page 32 is where it starts.
Good afternoon, Chairman Watson and committee members. My name is Candace Brose, and I serve as Commissioner of the Georgia Department of Human Services. My remarks will be very brief, largely focusing on the House's changes to the Governor's amended fiscal year 2023 recommendations for our agency. So first, starting off with the Senate's version of the amended, it's line 188.1 for departmental administration. The House maintained the Governor's recommendation to add $1,965,580 to increase funds for technology improvements and security upgrades to the integrated eligibility system in preparation for the public health emergency expiration. And these funds have already supported one-time costs to enhance security, including multi-factor authentication in Georgia Gateway for Medicaid redeterminations starting on April 1st, 2023. And it's allowed us to buy technology for more dynamic legal notices and e-communications, both of which cannot be easily changed in Gateway as required by the federal omnibus bill passed last December for contact attempts with our constituents. Moving to federal eligibility benefit services on line 192.1, the House revised the caption, which now reads, increased funds to support the staffing of 370 case managers, 75 supervisors, and 1 district manager for Medicaid redeterminations due to the public health emergency expiration. The total funding remains the same as the governor's initial recommendation, with $5,765,760. These funds will allow us to continue to aggressively recruit, train, and deploy more staff ahead of and throughout Medicaid redeterminations for roughly 2.6 to 2.7 million Georgians, again with that process starting this April. And it dovetails with the governor's recommendation on line 192.2 for $662,433 to increase funds for 80 additional Medicaid eligibility caseworkers to process cases due to the public health emergency expiration. This funding reflects roughly 1 quarter's worth of salaries for 80 hires who've been secured in recent months through aggressive recruitment. For example, we've recently screened nearly 1,600 applicants for these jobs, with 200 who have either started work or are moving toward a start date, more than 600 being processed in various stages of interviewing, background checks, et cetera. Moving to out-of-home care on line 193.1, the House added $5 million with the caption, "Increase funds for alternative housing options for youth with complex needs." These new funds, for which we are deeply grateful, will allow us to continue to reduce our reliance on hoteling, which is when we must temporarily place a foster child in a hotel or a DFACS office because we cannot find a suitable relative, foster family, or group home to meet their needs. Moving to out-of-school care services on line 194.1, the House reduced funds by $500,000 for non-programmatic expenses. In the fiscal year 2023 budget, we received $4 million for at-risk youth, $3.5 million of which we have already awarded to the United Way for after-school services covering academic outcome improvements, leadership development, and career planning. And we had planned on using the remaining $500,000 to evaluate contract effectiveness via an outside firm given the project's reach. As for our administratively attached entities, I'll defer to my colleagues at those agencies to provide better insight into any changes made on the House side, and that concludes our changes. Thank you for your time, and I'll gladly take your questions.
Senator Wright.
Thank you very much, Commissioner. That was kind of a race to the finish line with no accompanying materials. And the Medicaid unwind. What are we paying? What's the going rate for the? There was money put in the budget to expand the staff to engage with the Medicaid wind down, and how much money is put in for those 300, and what rate of pay are they earning, and is that a permanent job?
So for the economic support specialists, which are the individuals who are handling case eligibility on the front line, you're looking at a range of starting pay between $32,000 to $39,000 a year.
And those are not permanent jobs?
I'm sorry?
That's not permanent staff, is it?
Yes, they are.
They're going to stay there after the rewind.
Yes, ma'am.
Well,
they
you'd be
would.
mighty lucky to pick up some staff that way.
We've actually we've been incredibly fortunate. We've tried to execute some creative strategies, and really, especially for these positions, a lot of the work can be done remotely and can be properly monitored to make sure that you have good accountability in place. So we've been really trying to target a specific type of caseworker. What we find is that a lot of, for example, moms who can work a late shift, maybe in the evenings or on the weekends, that this is a position that could be beneficial for them, and it comes with benefits. So we are looking at a bunch of different ways to attract new talent and retain current talent, and that's been a successful strategy so far.
Is that workforce eligible for a family of 4? Are they eligible for Peach Care for Kids?
I think that it's certainly true that some of our staff are recipients of some of the benefit programs that we administer.
So they would be eligible at that level of pay for Peach Care for Kids?
It depends on the benefit program and the size of the household, other expenses that they would document as part of their case. But as I mentioned, yes, it is true that there are some of our staff who receive benefits and work for our agency.
Thank you.
Thanks, Senator Reich. So 193.1, that's the House added $5 million increase towards the youth relating to the complex needs of what we've termed hoteling or staying in the. Any update on that at all?
So what we continue to do is with the average amount, the daily rate of having a child in a hotel at roughly $1,500, what we found is that in many cases we can negotiate a lower per diem and have that child put in a more appropriate placement. So it typically means that we're talking about teenage children with serious mental health issues or a combination of behavioral health challenges that makes it tough to put them in a group home or with a foster family. And so we're typically using these funds to put them in a psychiatric residential treatment facility, in a substance abuse residential facility, or in a crisis stabilization unit. Especially if some of our children have dual diagnoses, autistic youth, that's where we have to go with non-contracted providers in certain circumstances, and so we see that that's usually several $100s, but it could be in the thousands depending on what the child may require in that placement. Yes, ma'am, per day.
Correct, right, for staffing per day. No problem. So maybe 3 weeks ago we were at 60 or so. Do we know about where we are now?
We were at 63 when I gave my remarks to the joint appropes. We're at 66 now. I pulled some statistics so we have 66 statewide who are either in a hotel or in a DFACS office due to lack of finding a suitable placement. 28 of those entered our custody either because the parents their caregivers voiced an inability to cope with their mental and behavioral health needs, or they were ordered into custody from the bench. It's typically the same reason.
Juvenile justice, right?
Yes, sir. 10 out of the 66 have a confirmed or suspected autism diagnosis. We have 10 with an IQ below 70. 13 of 66 have a prior crisis stabilization unit stay within the past 30 days, or within the 30 days preceding their placement in the hotel or office, and 5 have a prior PRTF stay.
Okay. Thank you. Chairman Tillery.
Thank you, Mr. Chairman. Do you know the average day stay right now?
At the joint appropes, when we ran the numbers, I think that we were looking at roughly 23 to 24 days on average. That's not truly representative of the population, because I would say a year ago, before the General Assembly, we had more short stayers, and that's no longer the case with our hotel population. We don't place children without high needs in a hotel or office placement any longer. So the 23, 24 average amount of days actually is more like 1 day than 60 days, something like that, closer to get the average.
So
these are more high needs children than last year.
66, most of them you're not seeing the 1 day
That's
in
correct.
and out. It's the folks who are extremely difficult to place now, is what you're telling
Yes,
us.
sir.
Mr. Chairman, can I ask 2 other budget questions, or if you need me to wait?
Go ahead, please.
Commissioner, and these are off the cuff. I apologize, I haven't prepared your ask or given you a heads up of these ahead of time. We saw what happened with DOL over the past 3 years. If you don't mind letting us know if you feel comfortable with what you've got concerning unwinding. I think from a legislative standpoint, we do not want to see the repeat there. I think I speak for all my colleagues on that point. So, but we want to make sure that we've given you what you need there. My question is about a specific, I wrote it down, I apologize, Mr. Chairman, and I flipped the page. Constituent calls that I've gotten literally in the past 4 days, and I apologize I haven't prepared you or told you about these yet, concerning fraud with EBT cards. I don't know if that's on your radar or has hit it or not, but if there is something we can do technology-wise, procedural-wise, something we can do differently. Can you get us that answer? Because it seems like the cost, even if it's millions, would be recouped in the savings. And I heard that from several members over the past few days. I don't know if it's a new thing or it's something you're already aware of, but if you know more about it and want to tell us about it, please let me know.
So it's been an ongoing problem where people that have an EBT card can be the victims of fraud, either through skimming or other mechanisms, identity theft. The issue has been here and in other states as well, that I think at the federal level, in terms of federal law and federal rules, that it was sort of silent as to whether states were compelled to reimburse someone who's been the victim of fraud. So some states have opted into a more flexible approach, some states haven't. And then with the passage of the federal omnibus bill, there were additional requirements now in federal law where states have got to develop a plan. I think it's within 60 days of the president's signature to submit to their regulators on how they are now going to compensate people who are confirmed to be victims of fraud. So we're working through that process still and working with our vendor, Conduit, and we have the benefit of the fact that that vendor is the EBT vendor for many states. So we're not going to reinvent the wheel. If there's been a good model developed in another state to put together this kind of plan, we're going to reap the benefit of that and prepare it for submission.
And just to be clear, this isn't that someone's using the card inappropriately. This is that someone who is a illegal recipient is being criminally victimized by it looks like organized crime sometimes.
It is theft. And so I know not a good example, it's actually a highly unfortunate example, is that we can tell that there is a merchant in Brooklyn, of all places, that seems to be really targeting Georgia EBT recipients, and only a few cases. It's a decent amount of money for very vulnerable people, but those pop up all over the place as technology improves in ways to steal people's money. We're just seeing more and more of this, and again, it hasn't been something that could be readily resolved. Even when people would try to appeal this to OSA, for example, it's just not something that the process that was already in place at the state level, which now we are working to remedy.
Any further follow-up? Got it. So, scamming, illegal activity relating to Georgia recipients of EBT cards. So, wow, okay. Thank you. Any other questions? I see none. Thank you, Commissioner Brose. Appreciate what you do. All right, we have one more presentation. Georgia Vocational Rehab Agency Executive Director Chris Wells. He's making his way to the front. And for the committee, it's page 43. He gets set up.
So we can just go here. Yeah, you just go here. Okay.
Ready when you are.
Okay. Thank you, committee. Thank you for the support over the last couple of years. Also, thank the governor's office for the support that they've provided over my first couple of years as well. I'm Chris Wells, Executive Director for the Georgia Vocational Rehabilitation Agency, and our agency is fairly small compared to our predecessor, but our goal and objective is to work with individuals that may have a disability achieve and attain employment. We operate multiple programs. The biggest of the two is VR, or vocational rehabilitation, and attached to that is our residential programs in Warm Springs as well as Cave Springs Center. Our next program, which is our very large program, Disability Adjudication Services, works very closely with our feds and SSA, so we are responsible for disability determinations. And so that's one of the programs that we work as subcontractors for the feds, and so we have limited flexibility, but we're seeing this program is one of the ones that's we're looking at making some adjustments and working with our federal partners to be able to get some of these claims processed. I think during the COVID years that we saw a run on a lot of the claims, and we're seeing nationally some issues and some concerns in trying to get the program moving in the right direction. Our last two programs are specifically for our blind and low vision population. We have the Business Enterprise Program, which if you've been to a vending location, that's probably one of our locations, as well as the Georgia Industries for the Blind, which is products and sales. And so our Georgia Industries for the Blind is centrally located or in Bainbridge, Georgia. And just like GCI, Georgia Correctional Industries, they work off products and sales. Our next slide is just a summation of GVRA's budget, so you can see the 5 programs and how they are budgeted as we are administratively attached to the Department of Human Services. Now, our next slide is just getting into the House bill. So if you're on page 41 of 59, we only had a couple changes. One of the biggest changes is 204.1 is we have an increase for one-time funds to upgrade our cloud-based ERP system for Georgia Industries for the Blind. And again, this is one of 2 manufacturing operations in the state. And so this particular program, we did a cost analysis and we looked at our operations since COVID, and we realized that our ERP system that's responsible for costing also our inventories and also looking at how we are able to make adjustments on the fly hadn't been updated in about 10 years. And so we looked at the market to try to get the system updated, and the cost for that is approximately $134,000. On 204.2, this is a transfer into the Georgia Industries for the Blind of approximately $742,000. Essentially, during the COVID and during the pandemic, we were just like a private sector company. We didn't have access to any additional PPE or federal funds to be able to support the operation, and so we came into the Great Recession with about $550,000 in surplus funds to be able to help us invest in diversifying our product lines. And so over the course of the last couple years, we've really dipped into that reserve to be able to help us maintain operations. And because of that, we're asking to transfer about $742,000 out of our biggest program, VR, into our Georgia Industries for the Blind. And so you'll see that corresponding change on 205.1, where we're reducing the state funds amount in the equivalent. And then our last recommendation, 205.2, we have an agreement with the Georgia Radio Reading Service of about $300,000, where they help us broadcast some of our products or some of our services, and they also work closely in the community to be able to provide broadcasting services, reading newspapers, and so this would be a pass-through directly to our Georgia Radio Reading Service partners. Our next slide just provides just a little bit more details about why we're asking for the transfer of the 742 along with the 134. This just gives a view of the last 13 or so years of the revenues that are tied to the Georgia Industries for the Blind. And part of it is, as a state entity, we didn't do the appropriate investments over the course of the years. We've invested in maintaining our most of our operations in file folders. That makes up about 65 to 70% of our operating. And so as individuals have moved to cloud, they've moved to virtual platforms, those file folders took a very big hit going into the COVID months. One of the biggest things that I learned throughout this process is PPE. We use Tyvek for our file folders, and when the DPA or Defense Production Act took effect, that reappropriated or basically moved a lot of the products and sales towards PPE, and so that impacted our operations as well. So this gives you an idea of kind of some of the challenges, but some of the adjustments that we've tried to make. Again, coming into the agency in 2020, we had approximately $46,000 in reserves. We made some strategic and streamlined some operations and got up to about $550,000. You'll see on FY 2021 that orange amount, but again in 2022, coming into 2023, we've had to dip into that particular surplus and wasn't able to do the appropriate investment. So the 134 is designed to get us back into investment, and then the 742 is designed to be able to help us be able to maintain operations as we continue to invest in the Georgia Industries for the Blind. Our next slide and our last slide is just provide some updates and some of the things that we've done over the last couple of years that we think we're seeing some improvements, and we see some light at the end of the tunnel. Investing in our ERP system, that's going to help us with our cost analysis. It's also going to help us with our inventories. It's going to help us be able to determine what market value for our costs and for our production. We also did a pricing analysis about a year ago and finally received permission coming into this federal fiscal year, and so those pricing adjustments took effect in January. We also invested in a mass machine to be able to help us. We just recently received level 3 certification, and so that's going to help us get on the national federal registry, where we become the primary seller for any mask that the federal government may require. And then lastly, we looked at a paper sheeter. One of the things with paper is that we're using a third party to cut paper for our blind and low vision employees that work there, and because technology has grown, has gotten better, we're actually trying to eliminate the middleman and that middle markup and actually purchase a paper sheeter that's actually blind and low vision friendly, so it creates an opportunity for 2 individuals to be able to work that machine. So instead of taking that middle person, that middle company out of the way, we're trying to move forward. And then lastly, we made some adjustments internally. We were spending about $150,000 in private storage. We have a storage facility at GIB Griffith, so we are actually redirecting a lot of our assets to a centralized location to be able to help us with asset management, and this will help the Georgia Industries for the Blind as well. Instead of having that go to outside, it can stay inside the agency. This concludes the presentation for GVRA. If you have any questions, I'll be more than happy to answer.
Chairman Strickland.
Thank you, Executive Director. Appreciate your presentation. I believe in the 23 budget, we included in the Senate $10 million for reopening some priority services. Can you give us an update on what that money has been used for?
Perfect. So we received about $2 million, but we get the federal match, so 41. So the overall amount is $10 million. That allowed us to open up some of the priority categories. We did a lot of streamlining prior to that, and so what was happening prior to my arrival is we were basically begging from Peter to pay Paul, and so we were moving money around our personal services, moving it into contracts, moving it into grants and benefits, and so we decided that personal services is personal services, grants and benefits is grants and benefits. And so that $2 million allowed us to open up priority categories. It's allowing us to match some additional funds to be able to help our centers for independent living. So we were able to fully fund a lot of those agreements in grants and benefits, and it has allowed us to be able to go into our school systems to be able to work. We currently right now are serving more individuals in our school than we have at any point in time. That is because that $2 million that was put in the budget that has allowed us to open it up. So that's also helping us to be able to maintain our grants and benefits, which has allowed us to increase our counselor pay as well. We started off when I first came to the agency, about $27,000 is what we were paying our entry-level counselors. Right now it's $45,000, and again, that's because we looked at how do we streamline, how do we maximize, and how we leverage technology, and keeping those things separate is allowing us to keep salaries competitive, but also make sure our providers are taken care of. And the last thing we also did with that $2 million is we increased provider rates. One of the things our providers are the ones that are serving. We contract a lot of our services out because we can't be in 180 plus school districts in 159 counties. So we have approximately 140 providers that we work closely with. So we were able to increase rates for our providers this last year, and that was the first time that was done in 12 years as well.
Can you give me a little bit of sort of understanding this $700,000 transfer to the?
So the $700,000, because we separated the budget, personal services, we created what we called transition counselors to get into the schools. We created transition supervisors and general supervisors. And so coming into this particular fiscal year, we budgeted for about 36. We had about, 13, 14 filled. We hired quite a few in December. We've hired quite a few this past month, and we've already made a couple job offers. So the 742 is essentially that lapse from those 36 budgeted supervisor positions that we're still filling, but in this amended year, we were trying to use those funds instead of ask for additional funds. If we can fix it ourselves, we're trying to go through the appropriate manner to be able to fix it ourselves instead of asking for additional funding.
Does GVRA lose the 4-to-1 federal match with that?
So in this particular case, and again, Ms. Mamta Patel is here. I'll give her all the credit. She's very good on the accounting side. I may be decent at the budget side, but she worked with our partners at the federal level to understand how do we do a better job of matching, and they provided some T&A. And so what we did is we were able to leverage the funding from this previous federal fiscal year to move some of those expenses, which created the ability to use, closing federal grants to make sure that we don't lose any services. So we would have potentially lost some federal match, but because the state fiscal year and the federal fiscal year crosses over, we'll be able to pick that match up in the later months, as well as going into that first 3 months of the state fiscal year to be able to match.
Great, thank you. Chairman Tillery?
Thank you, Mr. Chairman. Thank you, Director. As to the other funds, the sales of the thing, particularly out of GIB, are you meeting budget on that or exceeding it for what you projected for FY23?
So for FY23, we think we're going to be fairly tight. We feel confident. Typically, our sales right now, we think we'll probably be around, breaking even? So right now we're at about 1.4 in sales. Our operations usually run about 2.3. We're seeing the issue is we're seeing the orders come in. So the orders is not the issue. The issue is being able to get the paper in enough time to be able to deliver on those particular orders. And so the 742 was kind of designed that as those orders are still backlogged, if we can't get them filled and out of the door before 6:30, this is going to allow us to be able to do that.
We can follow up offline. Our number was showing more like $4.5 million. So I just want to
say that again.
I think our other funds was showing more around like $4.5 million.
Correct. So I think if you were to look at our budget appropriation itself, is that was the initial amount coming in when we used our cutoff, and so our budget has been adjusted to be able to meet. But this is the cutoff budget that was rolled forward in the early part of the budget development process.
I'll just follow up offline with you about it.
Okay.
Any further questions? I see none. Thanks so much. We appreciate that, Director. So I think that's everybody. Thank you, committee, for being here. Thank you, Chairman Tillery, for being here. Did you have a question? I'm sorry. You do want to be recognized? Okay. Okay. All righty, so I hope they got that on camera just then. Thank you, Chairman Strickland. I hear you. Okay, if not, committee's adjourned. Thank you.